Dr. Bruce Snyder is clinical professor of neurology at the University of Minnesota School of Medicine, former chair of the Health Partners Department of Neurology. He has recently retired after 43 years of practice. He's quite young to be retiring, I think. Dr. Snyder has authored over 50 scientific papers, book chapters, and review articles. He is a fellow of the American Academy of Neurology and has served as an examiner for the American Board of Psychiatry and Neurology. Dr. Snyder volunteers with several environmental organizations and is a member of the executive committee of the Sierra Club North Star chapter. Here he is.
Thank you, Karen, and thank you all for the chance to speak with you today. Climate change is in the news every day. The Pope certainly didn't leave a moment of it out of his visit, so he's a tough act to follow, obviously. But what I want to do today is briefly give you an overview of the impacts of climate change on public health, areas that we're concerned about, we being physicians, healthcare providers, healthcare organizations, and some implications for what might be done. I always like to start by saying that, excuse me, that when we're talking about climate change, there's optimism out there. This is not a total downer, and so we'll finish up with that, but let's get going. So climate change and public health. This is an image of the Mekong Delta region of Vietnam. There you see the shadowed area in the southwestern corner of the country. It's about 15,000 square miles and about 17 million people. The Canto University Climate Research Center in Saigon predicts that by 2030, a significant number of provinces within the Mekong Delta region will be inundated by sea level rise. And the question is what resources and infrastructure are available for those displaced people who in a way may be thought of as climate refugees. We'll get back to that. Let's do a quick definition. So climate change or global warming, you'll hear these terms kind of interchangeably used, and it refers to an unusually rapid and accelerating increase in global average surface temperature. So we're talking about the whole world, we're talking about an annual average, we're talking about temperatures near the surface, cold spot here or warm spot there, it all gets averaged in. 97% of climate scientists, and we'll see some other organizations, accept the validity of climate science, that this is caused by massive releases of greenhouse gases, principally carbon dioxide, generated by fossil fuel combustion by human societies in about the past 165 years. In addition to generating greenhouse gases like carbon dioxide and methane, our use of fossil fuels also generates large amounts of toxic pollutants. Air pollution involves organic and inorganic toxins, ozone, nitrogen and sulfur oxides. These are emissions largely from power plants. Mercury, our coal-fired power plants are major source of mercury pollution. Airborne particulates, tiny particles of liquids and solids that contain metal, mercury, organic toxins, and the like. In addition, there's water pollution, pardon me, ocean acidification. As the atmosphere's carbon dioxide rises, the ocean waters come into equilibrium with the CO2 content of the air. And this is good in a way because absorbing all that carbon dioxide, that kind of eases the effect of human societies on the atmosphere and the climate. So good for that. But in the process, ocean waters become more acid. You dissolve that CO2 in water, you get carbonic acid. Those of you who keep aquariums may know that the easiest way to kill off all your fish is to drop the pH and make your tank more acid. That is happening. Ocean acidification is impacting the ability of shellfish to form their calcium carbonate shells. This is one reason that the shellfish lobby is very much pro-climate mitigation in Washington. Ocean warming, again, as the ocean waters come into equilibrium with the temperature above them, they get warmer, different layers of sea water warm. This is damaging our coral reefs around the world. Estimates are that we've already lost about 40% of coral reefs throughout the world. Mercury, I'll come back to that, but I will say that the Great Lakes and the majority of Minnesota's lakes, rivers, and waterways are polluted with mercury. Minnesota has the highest number of postings limiting fish consumption for pregnant women because of mercury in the water. Mercury is a neurotoxin, and we'll talk more about that. Rising sea levels. Right now, just one instance is that Florida's fresh water supply is being endangered as salt water infiltrates and the fresh water supplies become brackish. Okay. Well, yes, climate change is controversial. What I can do in the short time we have is I'll just point out some organizations and authoritative individuals who accept the validity of climate science, and that includes the World Health Organization, National Academy of Sciences, Elon Musk, Warren Buffett, the American Medical Association, and certainly the Pope, Bill Gates, and so on. So there are a number of individuals, responsible individuals. These are really not necessarily tree huggers and so on. And there's not a lot of money in believing in climate change. The money is in fossil fuels. So I'll just throw that up there. I know it's controversial, and that's just the way it is. Those of you who remember Mad Magazine, I couldn't help what me worried, you know. Well, you know, a core issue, a core concept of Rotarians, as I understand it, and I'm not a Rotarian, is service to people, to the public good. And I think, therefore, I'm sure, I know that you are concerned about public health, issues such as peace, secure, safe food, water, shelter, social justice, poverty, and malnutrition. I know you're concerned about that. So if you are, and you are, then climate change has to be on your, or should be on your radar scope. As Margaret Chan, the Director General of the World Health Organization, pointed out a few years ago, climate change in all of its implications is a major threat to health around the world. Food, air, water, don't get much more basic than that. And these things are up for grabs now, and we'll get. Okay, I'm going to make a list of the health impacts of climate change. And when I say climate change, I'm including the pollution that I talked about. Food, water, and refugees, infections, infectious disease.
Can you use the mic?
Food, water, and refugees, infections, heat-related illnesses, trauma and mental health issues, heart, lung, and brain disease, asthma and allergy, collapse of medical and social infrastructure and support systems. So let's start with safe, secure food, water, shelter. The climate refugee issue, which I briefly touched on when I was talking about the Mekong Delta region, and armed conflict. Well, this is an image from the southwestern United States where grasslands on federal grazing lands are basically gone as we're going into 5 years of an unprecedented drought situation. The American cattle herd census has now dropped down to near where it was in the 50s and early 60s. Fortunately, we're extremely wealthy and we can import whatever we need, but that's obviously not true for everyone. Projections are that if we continue burning fossil fuels at our current rate, and we when I say we, I'm talking about human societies around the world, the rise in global temperatures by the end of the century may cause a 30 to 50% decline in crop production using current technology. Now, why would that be? Well, number one, heat means drought. Drought means crop production down. Increased heat and water in the atmosphere mean more extreme storms and flooding events which damage crops. You may be aware that Minnesota has experienced, depending on how you count, 3 or 4 500-year floods in the past decade. I think it was in the spring of 2014 when there were a number of Minnesota counties under flood conditions and others under drought conditions. So we're seeing these weather extremes. In order to keep up with world population using current agricultural technology, it's projected that we would need to double agricultural production by 2050. And what's going on in California, which is this very major source of food around the world, is an indication that there are problems brewing. Climate refugees. Again, we talked about the Mekong Delta potential situation. Let's talk about an actual situation. Typhoon Haiyan in 2013 was the most powerful typhoon ever recorded in the Philippine history. Storm surge up to 17 feet and sustained winds up to 195 miles an hour. Hurricane Sandy was around 125. Typhoon Haiyan displaced over 6 million people in the Philippines alone. So when we're talking about what the implication of these storms and superstorms, we have to begin thinking about population fluxes. And if a couple of million Syrian individuals are stressing Europe out completely, you can imagine or begin to think about what this could mean. But worsening droughts, pollution of water sources, melting of glacial ice, and mountain snowpack endanger freshwater resources. Again, one of the components of the California drought is the loss of snowpack in the Sierra Mountains. The snowpack there feeds rivers and releases in a gradual fashion water for that area. I'm worried about my time here. I'm going to skip this. I didn't know before I got interested in this that there is a Center for Climate and Security, but there is. And they did an analysis of over 60 peer-reviewed studies and showed a correlation between advancing climate change and conflict, including armed conflict between nations. Let's talk about infections. Our longer, wetter summer seasons, the end of September now, it's nice out. But what this means is that there are more generations of ticks and mosquitoes that survive through the winter, the milder winters, and that breed more generations during the summers. And so around the world, the frequency, the number of cases of tick-borne and mosquito-borne diseases has been going up. This is the pattern for Lyme disease in Minnesota from 96 to 2013. This is not related to population shifts or to the deer population, according to the health department. By the way, the Minnesota Department of Health website has a wealth of materials on climate change and health, and they publish some very important reports. Along with the warming of the planet, as you might expect, heat waves and heat-related illness become more of an issue. So in 2003, a prolonged European heat wave caused over 45,000 deaths in 5 countries. In 2010, the Russians experienced the most severe heat wave in their recorded history, going back, I think, to about 1850, as I recall. And that heat wave resulted in over 55,000 deaths. Major storms such as the Joplin tornado, which you may recall, or certainly hurricanes Katrina, Sandy, Typhoon Haiyan, result in a number of deaths, trauma, drownings, and that sort of thing. And in addition, the individuals who go through these events, I'm sure you can understand, experience mental health issues. And mental health treatment is often unavailable for extended periods of time. We're also talking about filling your prescriptions at a pharmacy that no longer exists, finding your insurance card, which is gone, electronic medical records are offline. So this is the kind of situation these superstorms create. Well, let's turn to heart, lungs, and brains. I'm a neurologist, so brains get the flourishing script. That's cardiopulmonary disease, stroke, and cognitive impairment. Now, I'm talking about cognitive impairment. I'm talking about impaired memory abilities, impaired ability, thinking abilities, processing new information, making decisions, that sort of thing. As air pollution rises, an estimated 3 to 5 million deaths per year are the result. And around the world, air pollution is the 8th leading risk factor for death. A number of studies show that as the levels of pollution go up, emergency room visits and hospitalizations for heart, lung disease, and stroke also go up, as do mortality rates. This is a map of wildfires in eastern Canada produce a smoke plume traveling about 1,000 miles down to the Virginia area. Of course, we've been experiencing smoke coming from British Columbia, Washington, and to some extent California. The smoke is airborne particulate pollution, largely, and this contributes to heart and lung disease, and statistically is quite significant. And the risk of impaired cognitive function in those of us who have run through a number of years is increased by long-term exposure to higher levels of particulate air pollution. In fact, there have been studies, these are autopsy studies of young people in highly polluted areas like Mexico City, showing structural changes in the brain that correlate with the level of pollution people are exposed to. The risk of developmental disorders is increased by air pollutants and mercury releases. Mercury is key here. The Minnesota Department of Health conducted a study showing that upwards of almost 10% of infants born in the Lake Superior Basin have elevated blood mercury levels. Again, the major source of mercury releases to the environment is coal-fired power plants. Elevated blood mercury levels place children at a higher risk of lower IQ and mood disorders. So this is a very serious issue. And yes, there are scrubbers for mercury, but they have not reduced the problem significantly. There's a lot of mercury out there. Another piece of it, oh gosh, is, forget it. there's no time. Asthma and allergies, the pollen season is prolonged, and we're seeing a lot more asthma and allergies in the United States. Collapse of social support systems. Just very briefly, I touched on this already, but if you have situations, storms like Sandy, Katrina, Haiyan, Joplin tornado, the support systems maintaining for people's health is impacted seriously. Methodist Hospital is backs up right against Minnehaha Creek, as you know. And in spring 2014, during the floods, when Lake Minnetonka went to flood stage, and so did Minnehaha Creek, they had to put up 6 feet of sandbags behind the building to save their data center, which was in the lowest level. Where are, in our buildings, where are the generators? Where are the electrical connections? Where's the plumbing? It's all in the basement. And so if you flood these buildings, as happened with Sandy, you've got a hospital that's in the dark, there's no running water, there's no power, there's no elevators, and so on. Pollution and climate change is expensive. University economists put together a paper in 2013, Steve Pulaski and Andrew Goodkind, showing that health and environmental damages from coal power in Minnesota are over $2 billion per year and rising. And they also noted that our fossil fuel companies are not paying for that. So in a way, this is, because we pay for it. So in a way, this is a public subsidy for fossil fuels. Okay, well, we don't want to wind up like these guys. And that's why I mentioned at the beginning, you know, I talk to people about this and their eyes kind of glaze over and they say, oh God, I'll just cash in the 401 and forget it. So we don't want to do that. And we don't need to do that. Because energy and power trends in the United States are going in the right direction. The single most noticeable utility industry trend is retirement of coal-fired power plants. The U.S. coal burn is now lower than it has been in the early 1980s, and the stock prices are reflecting that. The EPA's Clean Power Plan, which came out this year, these are new federal regulations on carbon emissions from coal-fired power plants. This is a first. It is a major and a very important step in taking us out of this growing level of risk. It will contribute to about another 90 gigawatts of coal retirement by 2030. Analysts expect that the price of wind and solar will continue to drop, such that by about 2050, wind may be comprising up to 35% of our fuel mix in this country. And this is not happening because people are environmentally concerned. This is happening because of the economics of the fuel and power. Minnesota Department of Commerce study shows that our electrical grid in Minnesota can handle up to 40% renewable energy sources without major expense or modification. Around the world, as of 2014, global emissions finally flattened. Before that, there was a continued annual rise, and yet the global economy continued to grow. Germany is now at 25% of clean energy and on track to reach 80% clean energy by 2050. Sweden, China has pledged peak emissions by 2030. The Paris meetings that are coming up this December are very important. The track record for international meetings to deal with climate change is very poor. But once again, we approach with optimism and hope. and you know, it's the kind of thing, how much worse does the situation have to get before people move? And that's really, you know, kind of what we're looking at. Because we don't want to wait until it gets so bad, because most of the changes that have happened because of carbon emissions and pollution emissions are not reversible. We have to stop them, but it will take many hundreds of years actually before the CO2 that we put in the environment drops. Okay. It is critical that U.S. elected officials of both parties understand the reality and significance of climate change and the urgent need to reduce the utilization of fossil fuels. Because even though the markets are moving in this direction, there are political forces which are seeking to block things like the Clean Power Plan. You may not be aware, but in the 2014, in the legislative session that just ended in Minnesota, the majority of the Minnesota House of Representatives went on record voting that they do not believe that climate change is real. This is a problem. Climate change need not be a partisan issue. Economically, structurally, this is something that we have to act on for the benefit of all of us, and so forth. So what could we do? And I'm almost done. Sorry. You know, what can you do? I mean, there are a number of things to do, but I'm going to say, first of all, join these organizations like the Sierra Club that are fighting to get us control of climate change. For the price of a cheap bottle of wine, you can get a year's membership to the Sierra Club. What you are doing is you're hiring lobbyists. you're hiring representatives to bring these issues and concerns to regulators and political leaders at every level of government. That's what your $15 is doing. The Natural Resources Defense Council, a number of organizations working on that. You can ask or find out what do your congressional representatives and candidates say about climate change. Do they accept that it's real? They don't. Do they have an idea what to do about it? They don't. Problem. Ask why some in Congress and on the campaign trail are trying to defund the Environmental Protection Agency and curtail NASA's Earth Sciences program. Defunding these agencies is a major problem. Make your concerns known. Organized medicine, my colleagues are very concerned about this. Working with a number of other people, I've created a climate change and public health course that will be held in Minneapolis. We're funded by the Abbott Northwestern Hospital Foundation and the Minnesota Department of Health, and we deeply appreciate that. And finally, stay in touch. Let's work together. I would love to hear from any of you. Thanks very much.
Do you have time to stay after and ask a question?